Thanks for coming on and attending this webinar this afternoon. We're very fortunate to have Dr. Ling, a dentist who has a keen interest in dental hygiene and the older person. Now, just before we get started, just a couple of housekeeping points. Please put your questions in the Q&A at the bottom of the screen, and we'll ensure that these get answered at the end of the presentation. We'll also be recording the presentation so that and it will be available to you through the Alzheimer's New Zealand website later this week. So with no further ado, please welcome Dr. Ling.
Right. Good afternoon, everybody. And I'd just like to thank Kathy for giving me the chance to join you guys this afternoon and to talk about the dental health of older people. So I'm just going to share the slides. Can everyone see that all right? Yeah?
Yes, we can see them.
Okay. Cool. All right. So my name is Guo. I am a dentist at the Auckland Regional Hospital and Specialist Dentistry. So I work for the hospital. We are a regional dental service here in Auckland. We cover the dental service for the Auckland and also the wider Auckland region. So as part of my hospital practice, we see a lot of patients, the older patients with medical problems that needs dental treatment at the hospital. So today's presentation is really about the oral health of older people. When Kathy approached me, I'm just going to try and see if I can go down the slide. Oh, yeah. I was asked to talk a little bit about what are the dental issues for older people living in aged care residential facilities. So with that in mind, the talk this afternoon, I'll focus on what we currently know. So what are the dental status of our older people here in New Zealand. Secondly, we'll talk about some of the common oral health problems. So some of the dental diseases that we can see in the mouth for older people. And lastly, we'll touch on the oral health assessment. So what we can do, especially for the older people in care facilities, especially as the baseline when you check their mouth, and also as you sort of regularly update the oral health assessment throughout their stay under your care. So first of all, I'd just like to acknowledge New Zealand Dental Association and also the Ministry of Health. A lot of my slides this afternoon is actually part of another presentation that I have been involved with, which is the workshop for caregivers of older people. Some of you might have heard about this workshop that has been run that has been going for the last at least 10 years now, and it covers the whole country. And here in Auckland, we've been doing this sort of 2 workshops or up to 3 every year, and helping the caregivers to, first of all, sort of know what they're looking at, and also some of the tips they can use when it comes to providing oral care for the older people. So a lot of the information on the slides this afternoon is available in a booklet, which you can download free from the NZDA website. It is a good reference tool that you can use later on if you want to come back and sort of look at what I presented. So it has got more details or explanation in writing in the booklet itself. So you can go to our website, the NZDA website, and under the public tab, you can go into the order resources and download this Healthy Mouth, Healthy Aging booklet. It's for free. There is the first version is the one on the left, and the second version has just been updated in 2017, is the one on the right. So you're welcome to have a look at that. So we'll start now. What we know. So what are the current dental status of the older people in New Zealand? So we know that the population in the world is aging. So about 70 years ago, 1950, the world is about, the size of the population is about 2.5 billion. And now in the year 2021, we have about 7.8 billion people all around the world. And this population is projected to increase to about 9 billion by the time of 2050. The thing that we need to be aware of is our older group of people are actually aging and living longer. So you can see by the yellow part of the circles, the charts, the 65 and above age group, this group of people will continue to increase, while the younger age group, 0 to 19, will definitely decrease. In New Zealand, it's likewise. Currently, 2021, you can see we are roughly around the 17% of our population is age 65 years and over. So in about 30 years' time, about 1 in 4 of the whole population will be age 65 years and over. So that's quite a big change. So every 4 people that you meet, it's likely that 1 of them will be over the age of 65 in 30 years' time. So how is that relevant to dental or to dentistry? So in the old time, in the past, when we talk about older people and their oral health or dental health, most of them have little or no teeth. So the treatment of choice in the past is pretty much if you have a dental problem, you have your teeth removed and you are given a denture to wear. So the oral health of older people in the past, we are dealing with mainly denture-related problem. But since this have continued to change, as with the improvement of education and improvement of technology, medical care, dental care, people are retaining their teeth longer into their old age. And you can see here on the right, the picture here, there is a dental transition from edentulation, which is no teeth, to a dentate group of older people. So they are keeping their natural teeth for longer in life. Here is an X-ray, a radiograph of an older person. You can see this person here has kept all their teeth besides their wisdom teeth. All the white bits are the fillings around their teeth. You can see on the right, lower right side, you can possibly see the implant in the jaw, which was placed to replace a missing tooth as well. So the thing about older people keeping their teeth longer, a minority or probably most of them, should I say, have a lot of restorative work done to their teeth to be able to keep them as long as they can. So with the dental people keeping their teeth longer, they also come with a burden of fillings in their mouth, which needs to be maintained and looked after. And this can be a problem when older people become medically frail or they need help with their oral hygiene. And if they ended up in care, a lot of time their oral health will decline quickly. And you can imagine if they have a lot of fillings, if things breaks, and if there's decay underneath the filling, and this can lead to a lot of problem very quickly. So just going back to edentulation again, so far New Zealand had 3 national oral health surveys, and we can see the first one was done in 1976, and the most recent one was 2009. So in all age groups, we can see edentulation is declining. So from 70% in 1976 to the most recent one, we can see a reverse. So about 30% of older people have sort of no teeth, while 70% of them at least have some of their natural teeth left. So this projection will continue to go down for edentulism. So it can pose as a problem for many people, not just the older person themselves, but also for the dental profession and also for all that look after the older people, especially the frail and dependent one. For us to look after dentures is pretty straightforward. You can remove the dentures from the mouth and clean them and put them back in again. But obviously, when someone has problems with their teeth and they're quite old and quite frail, it becomes a problem even with keeping up with the oral hygiene and dental hygiene on a daily basis for them. Okay, so just quickly go through that. So older people are not immune to dental disease. So dental caries or decay is a lifelong disease. So a lot of people assume that when we get old, we are immune to sort of dental problems. That's not the case. We know from a lot of studies that older people continue to have dental risk of dental caries. So what we do know roughly that as we age, most people will end up having one surface sort of decay per year. So if you can imagine, if that's not dealt with on a timely manner, you can end up with a mouthful of decay very quickly, as you can see with the clinical photos at the bottom of the slide. Dental caries unfortunately increases if you put in all the other social factors, all the other factors around the person. So if a person ended up in nursing home needing care, and if you put in dementia, the patient has cognitive problems, they are unable to look after themselves. So you can imagine oral hygiene, daily hygiene is not being looked after very well. There is definitely a risk of increasing dental caries. And a lot of these studies are done across in Australia, which has shown that dental caries increases as the functional ability of the person increases as well. So the last oral health survey in New Zealand, we decided to increase the survey to looking at older people who are dependent. So from the 2009 oral health survey, they've expanded that and in 2012 managed to come out with another study that looks at specifically the oral health of older people who lives in the rest homes. So these are categorized as the RC and those who live at home with some sort of daily home help. So RC versus HC. So I'm just going to quickly present some of the findings to you guys. The findings, some of the main conditions of interest are tooth loss. So the older people, they still have problems with losing teeth, dental caries, periodontitis, dry mouth, and oral cancer. So I will be touching on these later on in the presentation. So from the oral health survey of these older people, it's shown that the older adults in RC or residential care, they are at greater risk of developing complex oral health problems. So the RC group tends to be having more trouble. These are the group that are more dependent in some way. So in terms of their dental status, they are pretty much the same. So less than half of them has some of their teeth left. Among the group that have their own teeth, less than 2/3 of them in residential care has dental problems that needs to be treated. And only about 2 out of 5, about 43% of those in living at home had some dental problems. And 1/3 of the dentate older adults from both groups had untreated root decay. So they have decay on the top part of their teeth, which is the crown or coronal part of their teeth. They also have decay on the root surfaces as well. 1/3 of the dentate older adults in residential care, and about 22% in the home care group require one or more teeth extracted. So some of these older adults require dental treatment. Older dentate adults living in RC group had heavy plaque, so the oral hygiene is poor, in other words, and there are a lot of plaque and calculus compared to the one that lives at home. And for those who are edentulous, most of them are wearing full upper and lower dentures. Some of the reasons for not visiting a dentist for this group of patients, this group of older people, most of them believe they don't have a problem, which is a problem actually, even though they do have dental disease in their mouth. To them, it is not a problem. And cost is one of the reasons as well. And obviously, if they don't have teeth, they don't think they need to go to the dentist. And also an important one, which will continue to, I believe, will continue to increase, is the difficulty getting to a service or accessing service around the country. So overall, less than 6% of all older adults went without recommended dental care in the last year due to cost. Okay, I will now move on to the second part, which is the common oral health problems. Before we look at the problems or the dental disease in the mouth, we should try and understand what a healthy mouth looks like. So a healthy mouth should be free of pain and infection. So if you look at the photo on your left, this photo is showing a mouth where there is no tooth decay, or if there's any tooth decay, they have been treated either by the fillings or crowns. And you can see the gums are nice and pink. They're not inflamed, they're not swollen, they do not bleed when you brush your teeth. And you can see there's no lumps or ulcers or any sort of unusual color in any part of the mouth. So essentially, if you look in the mouth, you'll be looking at the white part of the mouth, which is the teeth that's showing. And then the rest of the mouth should be more or less pink in color or sort of light redness. So there's essentially just two colors besides the golden fillings here we can see on the photo. But if there's anything else than that, we need to be attentive to that and be a bit careful about what's going on. If we look at the structure of a tooth, this is a molar that has been cut in half. So if we look inside a tooth has three layers. So the outer layer is called the enamel. This is the hardest layer of the tooth. It is made out of crystals-like structure, and it is probably the hardest material that you can find in the human body. So it's harder than our bone, actually. So the second layer is called the dentine, and then the inner layer, which is the red part that you can see on the picture, is called the dental pulp. Now, dental pulp is where the nerves and the blood vessels sits within the tooth, and our tooth sits inside our jawbone, which is covered by our gingiva or the gum. So just bear in mind, the outer layer enamel is very tough, very hard. The dentine layer, it's not very obvious in the picture, but essentially they have little tubules that are sort of parallel in arrangement, sort of stemming out from the dental pulp towards the enamel. We'll be able to appreciate that a bit later with some of the other photos. So within this dentine layer, there are many nerve endings. So if you have decay to your enamel, most of us will not experience much pain until the decay starts getting into the dentine part. That's when the nerve endings are activated, and you can end up with dental pain pretty quickly. So the picture on the left is the healthy mouth again, and hopefully we can appreciate the picture on the right as a mouth that is not so healthy. You can see the gums are very swollen, they have receded, and you can see they're very red and they bleed if you touch them or brush the teeth. And you can see there's decay, there's staining, there's broken teeth. So all these are signs of an unhealthy mouth. Why do we need to maintain, and why do we need to keep good oral health for ourselves and also for older people? As we can appreciate, we need our healthy mouth to be able to eat properly and enjoy our food, and also for speech. If you have an older person that wears dentures, you can imagine if they remove their dentures, their speech normally changes. But if you put the dentures back in again, you can actually hear them speak more clearly. Having good oral health is important for a good smile, for our appearance, and also for our general health. As you can imagine, the mouth is intimately related or connected to the rest of the body. And if you have a dental pain or toothache, you can imagine that will affect the whole body. You can affect your sleep, your work, your eating. So our oral health is definitely connected to the rest of the body. We shouldn't be looking at them as a separate part of the body. We know some of the oral health problems can also cause poor sort of medical health. For example, if someone has poor periodontal health or gum disease, this can affect their diabetic control. So for a diabetic patient, they usually have poor periodontal health as well. So it sort of works in both ways. If you look after your gum, you'll be able to control your blood sugar better. And if you look after your blood sugar, you can actually improve on your gum health as well. So that's one of the many good reasons that we need to look after our oral health as well. So having good oral health maintains our jawbones as well, and this will be more applicable to those who are needing dentures later on in their life. So there are surveys out there that ask people what they notice if you meet someone for the first time. Is it their hair? Is it their body odor, their smile, or their eyes, or the way they put on their clothing? And not surprisingly, most of them will notice your smile when they first meet up with you. So a good oral health is important. Some of the general recommendations to look after our teeth, and also for the older people, we need to brush our teeth morning and night with a fluoride toothpaste. It's important to use a soft bristle toothpaste. For the older people, if they can spit the toothpaste out and avoid rinsing, so these are the frail older people, having a bit of toothpaste around their teeth in their mouth overnight will actually be beneficial, because the fluoride in the toothpaste can actually help to strengthen their teeth, especially if their oral hygiene is not very good. So if they can tolerate a bit of toothpaste, avoid rinsing them out, just spit out the excess, and you can have a bit of toothpaste staying around the teeth. Consider cleaning between your teeth, so things like flossing is important, or using an interdental brush to clean between your teeth. We should avoid sugar food, or avoid sugar in our food, and also sugar drinks, especially between meals. So every time we eat, our mouth gets very acidic. So if you keep eating throughout the day, our mouth is sort of maintained at an acidic level, which is not good for the teeth. So what happens is our body will usually reverse that acid in the mouth throughout our saliva. So you can imagine the older people with less saliva, some of them, are not able to reverse this acid very readily. So if they are snacking throughout the day, their mouth remains at an acidic level, which is a risk to their dental health. And then ensuring regular dental checks and professional scale and clean, hygiene clean at the dentist is important. So with the common oral health issues, when we come to looking after our older people, it's important that we check regularly. It can involve any part of their mouth oral diseases. So if there's any changes from the last time you check, it's important that it needs to be documented, and the doctors or the dentist needs to be informed, and a proper referral should be made. So I will start with dental caries. Dental caries essentially is a destruction of the tooth structure, as you can see in the photo on the left. So it's caused by bacteria in our dental plaque. So whatever we eat, the sugar from the food will feed on these bacteria as well. So when the bacteria feed on the sugar that we eat from our food, the bacteria produces acids. So together with all these, it can cause breakdown of our teeth. So decay can occur underneath our crowns, around our crowns, underneath the fillings, or in any exposed part of the roots. Because if we go back to that photo before, the enamel is only covering the crown of the tooth. So if the gums have shrunk, the root surfaces are not as strong or are not as hard as the enamel. So they can easily get decayed if they're not being kept clean. The initial process can be painless, as we talked about the enamel layer, but as the decay continues to progress into the deeper layer, like the dentine and to the pulp, pain will definitely hit very quickly. So here you can see the many surfaces where dental decay can start. It can start from the occlusal surface, from in between your teeth. So on the left side here, picture here, you can see from the top, from the side, you can start from the neck of the teeth or the root surfaces as well. So the picture on the right are clinical photos of how the decay can start. And if you leave them long enough, you can see the whole tooth or the crown of the tooth can slowly sort of break away or erode away. So here is another a better picture where you can appreciate the different layers. So if we look at the one on the right, decay can start from the side of the tooth. So it will start from the enamel, it will break down the enamel and eventually hit the dentine. And you can see how it sort of follow a parallel pattern straight down into the pulp. So these are tubules or pipes that you can see in the dentine, and within the dentine there are those little nerve endings. So that's why it will just the bacteria will just follow the pipes into the pulp, and when it hits the pulp, then you can end up with a lot of dental pain. Bacteria will keep going if you don't do anything about the problem. It can go straight to the end of the root, which can eventually cause an abscess, which itself can also cause a facial swelling. So on the clinical photo on the right, you can see the gum swelling up. You can possibly appreciate there are pus in there as well. So this can lead to a dental abscess. So the sooner we can get the dental decay sorted in the enamel and dentine layer, you can still preserve the tooth. But once the decay or the infection has gone into the pulp, you'll need a root canal treatment, which is an expensive type of treatment to keep the tooth, or you'll probably need to have the tooth taken out. So it's very important when we assess our older patients that we need to pick up on some of the early problems quickly so that they can get their treatment done in a timely manner. So just the stages of tooth decay again, it can start from early decay into the dentine, into the pulp, and then you can end up with an abscessed tooth. So some of the warning signs that you look out for, if there is the teeth are covered in a lot of tartar or food or debris, they're not easily removed. You will probably imagine there are cavities or holes in the teeth, which is collecting those food and getting stuck in the teeth. So these are signs of dental caries or dental decay. Teeth are, grossly broken or discolored. Patients or older people are complaining of toothache. The early stage, teeth will become very sensitive, especially when it's in the dentine layer. You can imagine as the nerve endings are activated, you get that sensitivity to your teeth. When your teeth are sore, it's difficult to eat, or when they're broken or decay, and you can end up with a bad breath. And also, in the worst scenario, you can end up with swelling around your face or in the jaw. So the main thing to prevent dental decay, again, is to brush our teeth twice a day. And also for the older people in rest homes or in care facilities, they should have an oral care plan, just like their medical plan. So whether they have a special toothpaste, a special toothbrush they need to use, electric brush or a manual brush, or if there's any cleaning aids to use in between the teeth, those should be nicely sort of written up for each individual patient. Most of the older people should reduce in their sugar, food or drinks, and which we talked about, to avoid snacking if we can. I think this is a problem because a lot of the rest homes that I visited in the past, you can see they serve breakfast, morning tea, lunch, afternoon tea, dinner, and there's always coffee and tea around. And some of them are dependent on the, some of the oral supplements they have to sip on all the time, things like Photosip. They can be high in sugar. And the thing about Photosip, they sort of stick to your teeth. They're quite sticky, sort of consistent. So if they're not being rinsed out on a regular basis, the mouth is not, having a good rinse after all these, it can lead to dental caries quite quickly. Root caries is just to appreciate the different surfaces of dental caries. So it's more at the neck of the teeth when the gums have shrunk. So you can see when the roots are exposed, you can end up with decay. And the picture on the left is actually a result of toothbrushing. So when you're brushing your teeth too hard, some of us will brush our teeth in a horizontal manner. So if you scrub your teeth or using a hard bristle brush, best to avoid them, or else the dentine or the root surface part can actually wear down very quickly. So tooth wear is another problem. As we age, our teeth will break if they're not maintained well. So teeth can actually get worn down pretty quickly, or in some of the older people, if they grind their teeth, they can lead to destruction of the teeth. So you can imagine the picture on the left. They can have sensitivity. They can have pain. So in this case, it's very important that they are referred to the dentist so that things can be managed properly. May needs a lot of fillings done to cover the bits that are exposed or worn to prevent further destructions. Some of these teeth that are chipped or worn down can be quite sharp, the edges, and they can be cutting their lips or their cheek or their tongue. So it's important that we do sort of notice what's going on with the teeth of our older people. So those are dental caries. We'll now move on to gum disease or periodontal disease. There are essentially two forms of gum disease: the early mild form of gum disease, which is gingivitis, and then the more advanced form of gum disease, which is periodontitis. Now, most of us will have some form of gingivitis in life, but if we don't sort of maintain or look after them, this can lead to periodontitis, which is a more destructive disease that can actually affect the underlying bone structure that support our teeth. And as you can imagine, if the bone are shrinking away, this can lead to tooth loss very quickly. So gingivitis, which can eventually lead to a lot of gum destruction, swelling and bleeding. And eventually, if things are shrunk badly enough, you can see how the teeth appears longer and the roots are exposed. The teeth are wiggly and loose. And the message here is, unfortunately, periodontal disease, if you ended up with the more advanced form, you cannot go back to the earlier state of disease. Things cannot improve, but you can manage them, and it's important to try and pick up the stages of gum disease to try and maintain them before they get any worse. So this picture here is just to appreciate the bone structure around the gum. So at the far right, you can see how the bone has shrunk away as well. This is a result of the buildup of plaque and tartar around our teeth. and the plaque and bacteria and the tartar can create an inflammation around the gingiva, which all these reactions to inflammation can lead to further destruction of the bone structures. So if you have less bone structures around your teeth, the teeth becomes wiggly and loose, and that can lead to advanced sort of periodontitis. So the warning signs of gingivitis or periodontitis are swollen gums, red gums, tender gums, they bleed, bad breath, and in the more advanced stage, you can get very loose teeth, or even you can get gum infection where pus can be seen sort of draining out from the gum itself spontaneously or when you're brushing. So again, the prevention is pretty much the same as what as for the dental caries, which is to brush again twice a day with a fluoride toothpaste, and also cleaning between our teeth is important, so flossing is important, and also the diet part, and also getting to the dentist on a regular basis. The next part is dry mouth, which is a common oral health problems with older people, especially with older people on polypharmacy or on a lot of medications. One of the very common side effects of drugs is dry mouth. So if an older person has lots of medication that they need to take, you can imagine the mouth can become very dry very quickly. A dry mouth can affect the way they swallow or their speech. So just the general sensation of the mouth is very dry. And in worst scenario, you know, some of the older people complain that their mouth is burning or it's actually painful. And because the mouth is dry, because one of the role of saliva is naturally cleaning our mouth as well. Without saliva presence in the mouth, this can lead to a bad breath as well. So prevention or management of dry mouth, it's important again to follow strict oral hygiene routine. So for a lot of these patients with dry mouth, at the hospital, we sort of encourage them to use things like salt and baking soda rinses. So it's a very straightforward kitchen salt and baking soda that you can mix yourself. And from the mix, you can take a teaspoon into a glass of water, which you can use to rinse your mouth after each meal or whenever your mouth feels dry. So we use this a lot for our head and neck cancer patients who have radiation treatment to their head and neck region, where their salivary glands are damaged from the radiation and they can no longer produce saliva properly. So in order to sort of prevent decay or prevent oral health problems or prevent dry mouth, you can easily just mix up a bit of salt and baking soda. And baking soda bicarbonate actually reduces acids around the mouth as well. So it's good to clean, it's good to reduce acids around your mouth. So I always tell my patient that treat baking soda rinses as your saliva. So every time you eat, you need to go back and rinse out your mouth quickly. The trick is to actually rinse for a good amount of time, so at least 30 seconds to a minute around your mouth. It's not just an in and out sort of rinse. You need to keep that mouth rinse around your mouth for a good amount of time to let the baking soda sort of clean and also reduce the acid at the same time. If there's an opportunity to change the medications or reduce medication, that will help with the dryness, and make sure that older people drink plenty of water to avoid dehydration. And just avoid sipping on sweetened drinks. So when the mouth is dry, as mentioned before, if you sort of sip on sweetened drinks for the whole day, the mouth just doesn't have time to rest. So the mouth is constantly at the acidic level. And for people with dry mouth, they will need extra sort of special products, toothpaste that has a higher fluoride to look after the teeth or to protect the teeth better. This is, we talked about this, easily we can do this for the restaurant patients if you are looking after them. So this is something that we can mix. They can easily mix as well, or the staff can mix for all of them. I have challenged some of the restaurants to consider having everyone rinsing their mouth after their meals. So for the staff members to actually give everyone a glass of salt and baking soda mouthwash to rinse in the kitchen or in the dining room after their meal, so that at least their mouth has been, at least everyone can get their mouth rinsed out after their meals. So this is just one of the way that we can help with the oral hygiene for our older people in care. Oral ulcers is something we need to look out for. So besides the teeth, we need to look at the other parts of the mouth. So the tongue, the lips, the cheeks. You can occasionally get ulcers as well. These are usually caused by trauma, or if a tooth is broken, you can imagine the sharp edges of the fillings of the broken teeth. It can cut your lips or cut your tongue or cut your cheek. Or if the dentures are not fitting very well, this can all cause ulcers in your mouth. They usually heal within 2 weeks if you fix the dentures, or if you fix the broken teeth, or you take away the sharp edges that you're no longer sort of biting your cheek or your tongue. The ulcers will heal on its own. But if ulcers does not heal within 2 weeks, it's important that you let the doctors know, and also a referral to the dentist will be important. So that's pretty we talked about this before. So the ulcers that lasted longer than 2 weeks, it's really because of oral cancer. It's something that we should be aware of. You can get cancer in your mouth, and older people are not immune to oral cancer. You can get cancer of your lip, your tongue, your cheeks, or any part of your mouth, back of your throat. So if the ulcers doesn't heal, we need to let the medical doctor know, and a referral is made on a timely manner. So I'm just going to show you now a few photos of cancer, which you may not appreciate, some of us. So this is an oral tongue cancer. You can see a huge ulcer on the left lateral tongue. So the ulcer will not heal on its own. So for things like this, the ulcer needs to be biopsy and confirmed cancer, and then further whether surgery or radiation treatment will be required. This is a cancer of the lower lip for a patient. So again, you can see a trough of the ulcer. The borders are quite rolled, it's thickened, and this ulcer will not heal after 2 weeks on its own. So again, this needs to be highlighted to the medical team. Some of the warning signs, as we talked about, 2 weeks is important. So if anything doesn't heal within 2 weeks, it needs to be escalated, and you need to inform the doctors so that a timely referral can be made. Some of the things we can encourage the older people to do is to quit smoking and reduce the intake of alcohol, because we know that smoking is a big risk factor. And if you plus alcohol to it, it has a sort of additive effect or risk to getting cancer around your mouth. And then eating a healthy, balanced nutrition, and also regular check with the dentist. It's important to pick up oral cancer quickly or in the early stage, so that it doesn't cause too much detrimental effects if it's in the advanced stage of cancer. The other things you notice with older people is they can get oral thrush, or what we call candidiasis, so a candidal infection in the mouth. Now you can see on the photo on the left, this is a mouth where you can see all the white sort of plaques or white bits that's on the tongue, coating the mouth. So if you wipe these white bits, it will, some of them will be hard to come off. So it's sort of a classic sign of a thrush infection in the mouth. So most of them, it's a result of a deficiency or a immunocompromised problem. So if a patient is immunocompromised, or if they have a deficiency with any sort of nutrients, they need to be dealt with properly. So the underlying cause needs to be investigated. In the meantime, they can have some antifungal to help, and the doctors are best to chart these for them. So the warning signs are these white patches are hard to be wiped off. and the mouth can appear quite red, and they can be quite inflamed. So for some of these, because of the dry mouth, they can also lead to a sort of candida infection. So a good oral hygiene, rinsing the mouth using antifungal medications, and we need to talk to the doctors about what we can prescribe. Patient wearing dentures, if they don't remove them on a regular basis or daily basis, you can end up with candida infection underneath the denture where it's been sitting in the mouth for a long time. So on the photo on the left, you can see the outline, the redness on the palate. This is basically where the partial denture has been sitting in the mouth, and if it hasn't been removed on a daily basis, if you left it in there for a long time and not kept clean, that can lead to what we call denture stomatitis or fungal infection of the gum as well, or the palate. So for dentures, it's important to have them removed on a daily basis and clean, and before you put it back in again. For most of the denture patients, we do encourage them to have their dentures out at night time and just giving the mouth a bit of time to rest overnight. So for these denture stomatitis, you definitely need some antifungal medications, gel that you can put onto the inflamed or red surfaces of the gum, and that will help to clear out the infection. So lastly, we'll talk about oral health assessment, what we can do and what we are looking at. Our recommendation is it needs to be done on a regular basis. Definitely as a baseline, when a new resident comes into a rest home that has just started at your, just joined your rest home and you are looking after them, and you need to sort of have a baseline check of their mouth. Each of them will have an appropriate sort of oral care plan. This can be discussed with their doctor or their dentist. If they don't have one, it's important that we do talk to their family and see if they can organize for a dental visit checkup first and to get their teeth looked at, and then care plan can be put together for these older people. It needs to be done on a regular basis, so maybe every 3 months at least, to make sure that the oral health hasn't changed. So we look carefully around the whole mouth, so not just the teeth. We look at the soft tissues, the lips, the cheeks, the gums, the tongue, and also the dentures. One thing about dentures, some of the older people will be keeping their dentures for a long time, so they become very worn or very loose. So in cases like this, a lot of the older people use the denture adhesive or the denture glue to try and help with the retention of the dentures. But sometimes you can only do so much with denture glue or polydents. If you use a lot of glue every day, it's just saying that the denture needs to be replaced. It's no longer working properly. So we need to let the family know or the older people know. So when we look in the mouth, we look for signs of the dental caries or the gum disease that we talked about, ulcers that we talked about. So all those dental disease that you can sort of differentiate from a healthy mouth. And the important bits is we need to document the changes that you see, and we need to refer the patient to a dentist or getting the in-house doctor to have a look at the same time, which is important. Oral health assessment should be, as we say, at the commencement of the older person residence, a plan and clear documentation in the care plan. And if any changes are identified, we need to let someone else know quickly. So when we look in the mouth, we can use a dental mirror. If you have a dental mirror available to use, it's important that you can use a dental mirror. Or easily you can use the wooden spatula or the toothbrush of the resident or of the older person. You can use those as an aid to actually try and retract the lips or the cheek away to have a good look. You need a good light source when you're looking in the mouth. So some of the carers we have talked about, they can use one of the headlight that you can buy from the Kathmandu or places like that you can use for tramping. So those kind of headlight will be helpful, or someone else will have to shine a torch in the mouth for you if you're looking in the mouth. You need to check if there's any swelling by actually pushing on the gum, palpating the gum, or if the person is telling you the tooth is sore, you can check by percussing or tapping on the teeth. And again, I've sort of mentioned a lot of time, we need to document the what we see and any changes. And if we have instigate any sort of plan for them, we need to review if things have gotten better. And then if not, we need to refer them in a timely manner. So that's pretty much my presentation. Again, you can go to the website to download this the booklet. And at the back of the booklet, there are 2 appendix, which is helpful that you can use for your assessment. So the bit on the left is basically talking about the oral assessment that you can follow through by ticking the different boxes that will apply when you look in the mouth. So things like the dental status, the oral comfort, the condition of the teeth, the tongue, oral hygiene. So it's pretty straightforward. You tick the bits that if you are concerned with, you need to let someone know, especially the doctors and the dentists. In the appendix 2 is basically a care plan that should be put together by the dentist or the visiting doctors, if possible, with discussion with the oral health team. Okay, so those appendix are available in the booklet that you can download, and you can use them freely for any of your patients or residents. I better stop there, and I'm happy to take any questions.
Thank you, Dr. Ling. That was fabulous. A great review of anatomy and oral health disease. A couple of questions for you. When you talked about the mouthwash that you could make from salt and baking soda, that's obviously a very economic way of,
yes,
instead of using a mouthwash. Would that be recommended?
So some of the commercially available mouthwash, they have different uses for it. For example, some of them are specifically for infection, so antiseptic. For the salt and baking soda, they're really a good mouthwash for cleansing and also for dry mouth. So for all those reasons of the older people who are struggling with the oral hygiene, there is no harm using salt and baking soda. But some of them will benefit from other mouthwashes as well. But salt and baking soda, I think, is a good start. Yeah.
So the second question just relates to the brushes. And you did allude to the fact that heavy brushing just wears down the enamel. Is there any particular kind of brush that's more suitable for these older people?
Yeah, so soft bristle brush is what we recommend. So anything with soft bristles on it. So if you go to the supermarket, the toothbrushes they usually come in medium or soft, medium, and hard bristles. Just ignore the medium and hard because they're really there for some sort of marketing, I believe. So just pick the soft bristle brushes. That's important. If older people can tolerate electric brush, I think that will be a better toothbrush to use because especially those who need help with toothbrushing. So the other person, whoever's doing the brushing, can actually just guide the electric brush around the teeth. It'll be more efficient doing it that way. And most electric brushes are soft bristles anyway. Yeah.
And the final question just relates to people with dementia. And we know that they're not always cooperative. Do you have any hints about how we can do the best we can with their oral health?
Yeah, so there are probably no good answers to this. It's not easy. We have patients coming in, with cognitively really challenged, and it's difficult to follow instructions. They don't sort of open their mouth for you. And some of the time you do need a second pair of hands, so that you need 2 people to actually attend to a simple task of toothbrushing. One will have to try and distract the person. and the other person will have to try and get in the mouth. Pays to get 2 brushes. So if you can use 2 toothbrush, one to try and push or retract the lips away or the cheek away, and then you can start brushing away, and that will just help. For those who really don't open their mouth, if they allow you to actually get close to them, you can try and pull the corner of their lips, and that sometimes sort of helps them to understand or try and open their mouth for you. So just literally with your finger pulling the corner of their lips away, and their mouth sometimes will open up, not all the time. And it's such a trick that I found with my patients that you can help with. And if they can maintain their opening, and I think you are doing well. If they keep closing back, then you do have a problem. Maybe for those patients, you may have to think of when is a good time to do their brushing, whether we have to compromise and only do their brushing when they are having a shower, and do it when they're, knowing that they're getting their shower done at the same time. But yeah, try and distract them, finding a good time, but looking after yourself as well. It's important, your safety, because you just never know if they will bite down on you and things like that. Yeah.
Well, that's all the questions I have, and clearly the oral assessment on the back of that book would be fabulous for any client in aged care.
Yeah.
And, the tips you've given us on the mouthwashes, what to look for in terms of beginning disease, it's great. So
you're welcome to use those. It's free to download. Yeah.
Okay.
Well, thank you, Dr. Ling. What a marvellous presentation. I've been glued to my seat the whole way through, and I thought that it was really informative. And I also loved your slides and your photos, because I think actually get that visual appearance of what it really looks will help the nurses in the facility, because you suggested at the end that, you get your little mirror, and if you get the opportunity, especially for our dementia patients, it might be more challenging, but to get a mirror and have a look so that they actually got some heads up around what that might look like in the mouth. So I think it was all the questions that I had perhaps going to ask. You covered the whole lot. So thank you. And if we were all here in the as an audience, we'll put our hands up and say thank you very much. Thank you.
There's actually a part in the booklet that talks about further about some of the tips that you can do with patients with dementia.
Cool.
So yeah, I didn't sort of talk about that today, but you can refer back to that booklet.
Yeah, I think that booklet's going to be very helpful for a lot of nurses out there in the sector. So we'll say goodbye and good luck and have a nice afternoon.
All right. Thank you, everyone.
Bye. Thank you.